I am Dr. Deepak Manhas. I am basically a chest specialist in private practice in Pathankot. I'll be speaking on understanding hypertension. Our today's discussion will be on what high blood pressure is and how to prevent it. Generally, everyone would like to have healthy or normal blood pressure, but what exactly does it mean? Basically, each time when the heart beats, it pumps blood into the blood vessels. This creates pressure against the walls of the blood vessels. This is called as blood pressure. Normally, in healthy persons, the blood pressure rises and falls throughout the day, but when blood pressure remains high for a longer period and is left untreated, it can lead to serious health complications. In general, persistent increase in blood pressure higher than normal blood pressure is known as hypertension. High blood pressure usually develops over time. It can happen because of unhealthy lifestyle choices, for example, not having enough regular physical activity, obesity, smoking, high alcohol consumption, and stress, to name a few. There are other risk factors that also increase the risk of developing hypertension, such as age. As people get older, the arteries stiffen up and narrow as excess fat builds up inside the blood vessels. Family history of high blood pressure. One or more close family members with hypertension increase person's risk of developing hypertension over a span of time. Excess salt intake is responsible. Not eating enough food with potassium can increase blood pressure and the risk of stroke and chronic kidney disease. Eating processed and fatty foods increase the fats throughout the body and make the heart work harder to push blood through the arteries, hence causing blood pressure to rise. On the other hand, lack of physical activity is also linked to obesity and further to high blood pressure. Another cause is stress. Reacting to stress in unhealthy ways or not managing stress can also increase the blood pressure. Moving on, hypertension does not have any obvious signs and symptoms. That is why it is often called as a silent killer. It puts people at risk for several diseases, from cardiovascular problems to kidney failure, stroke, and even eye damage and blindness. Hence, early and accurate diagnosis is very important in management of hypertension. Measuring of blood pressure is the only way to know whether a person is having high blood pressure or not. Generally, when symptoms do occur, they include morning headaches or tiredness or vision changes or buzzing in the ears or fatigue, nausea or vomiting. If person is experiencing some of these symptoms, then one should get their blood pressure checked. Fortunately, high blood pressure can be easily diagnosed. It is usually measured with an instrument called as sphygmomanometer. The blood pressure is recorded in two numbers, systolic and diastolic. Now let us try and understand what do these numbers actually mean. Healthy or normal blood pressure should be lower than 120 mm by 80 mm of Hg. It can also read as 120 over 80 mm of mercury. Here the upper number indicates the systolic blood pressure, which means the pressure in the blood vessels when the heart contracts, whereas the lower number indicates the diastolic blood pressure, which means the pressure in the vessels when the heart is resting or dilated. If blood pressure level is more than 140 by 90 mm of Hg persistently, then the person is labeled to have hypertension. If person have BP levels higher than this all the time, then he or she might be at risk of developing serious heart diseases. This risk can be prevented and reduced by taking steps towards healthier lifestyle, such as regular exercise, healthy diet, quitting smoking and reducing alcohol intake, regular blood pressure monitoring, stress management, adherence to medicines. If blood pressure is successfully controlled with such lifestyle modifications, then it might avoid, delay, or reduce the need for medication. So let us take a look at these strategies one by one. Regular exercise or physical activity. This goes a long way in preventing the development of hypertension, as well as it helps in keeping the blood pressure at the desired level. So regular physical activity makes person's heart stronger. If one have a strong and healthy heart, it can pump more blood with less effort, so heart has to work less to pump, and the force on the blood vessel will be decreased and it lowers the blood pressure. In other case, as we are all aware that weight gain and age are two major risk factors for high BP. So if the blood pressure is at a desirable level, that is less than 120 mm of Hg, then exercise can help prevent it from rising as you age. So exercise is beneficial in all the ways. Regular exercise also helps you maintain a healthy weight, which in my opinion is an important way to control blood pressure. One should aim for at least 30 minutes of aerobic activity most days of the week. High blood pressure level can reduce, high BP level can be reduced by doing regular structured exercises such as brisk walking, jogging or swimming, etc. Healthy diet also plays important role in controlling blood pressure. A diet with high intake of vegetables, fruits and whole grains is recommended for hypertensive patients. For lowering blood pressure or preventing hypertension through the dietary intervention, one can adopt a dietary pattern such as DASH diet or a Mediterranean diet, eating less saturated fats and total fat, getting plenty of potassium, limiting the amount of sodium in the diet, and limiting alcohol consumption. DASH diet stands for dietary approaches to stop hypertension. Eating a DASH diet that is rich in whole grains, fruits, vegetables, and low fat dietary products and skips on saturated fat and cholesterol can lower one's blood pressure by up to 11 mm of Hg. If having high blood pressure, reduce sodium in your diet. Even a small reduction in sodium in the diet can improve the heart health and reduce blood pressure by about 5 to 6 mm of mercury. If you have high blood pressure, to decrease the sodium in diet, you must consider tips like read food labels before you buy, eat fewer processed foods, and don't add salt or avoid added salt. Quitting smoking is the most important intervention. It can decrease the blood pressure as well as it will prevent the further increase in blood pressure. Regular blood pressure monitoring is very important. It can be done at your doctor's clinic at the time advised by him, as well as home based blood pressure monitoring is also important. That is in fashion these days. Patient can have his blood pressure monitored at home, convenience of his own place, and many times in a day. This gives us a better overall idea of blood pressure readings for the patient. We can guide him accordingly. Stress management, by learning how to relax and manage stress, one can go a long way in reducing stress. And stress management techniques include exercising, listening to music, focusing on something calm or peaceful, and meditating. Adherence to medicine or compliance is very important. So I will advise, I personally feel that whatever medicine is picked by your doctor for the control of hypertension should be adhered to religiously. It should come from a good company, doses should be correct, and you should take it at an appropriate time and should strengthen it by home based monitoring of blood pressure. And always remember, as the season changes, blood pressure tends to fluctuate. In winters, BP tends to rise. That is the time we increase the dose. And when the summers approach, the blood pressure tends to have a better control. We can reduce the drugs at that time. Always stay in touch with your doctor all the time on a regular basis and take your medicines regularly. Along with dietary control, weight reduction, stress reduction, quitting alcohol, quitting smoking, and picking up correct food. That goes a long way in preventing the complications of hypertension and good control of hypertension. Thank you very much.